In today's video, we're going to talk about drug coverage when you have both Medicare and Medicaid. First off, it's important to understand that if you're enrolled in Medicare, regardless if you have Medicaid or not, you're expected to get your drug coverage through Medicare Part D. Medicaid will not pay for your prescription drugs. They must be billed through Medicare. Medicaid will provide extra help. Extra help with prescription drugs, also known as Low Income Subsidy, or LIS, is a federal program administered through the Department of Social Security for people with limited income and resources. It lowers or eliminates your Part D costs like premiums, deductibles, and copays. If you have Medicaid, you are automatically enrolled. Here's how the two work together. You need to be enrolled in a Medicare prescription drug plan. Extra help chips in to reduce your costs. In 2025, you pay around $0 to $4 for generics and up to $11 for brand name drugs. Some people pay nothing. Medicaid doesn't pay the pharmacy directly, and it all flows through your Part D plan. So to summarize, if you have both Medicare and Medicaid, your drugs must be billed through Medicare. Extra help chips in and reduces or eliminates your copays. But also, if your Medicare prescription drug plan has a deductible, you no longer have to pay it. Extra help can pay all or part of your Medicare Part D or C plan premium. If you have a Part D late enrollment penalty and you qualify for extra help, you no longer have to pay the penalty. Also, you get a special enrollment period you can use to change your prescription drug plan. Or, if you have full Medicaid, you can use the special enrollment period to enroll in an aligned dual special needs plan. We'll talk more about that in Chapter 15 of the Medicare and Medicaid Survival Guide. You should also know that even if you've been denied Medicaid, you may still qualify for extra help. To apply, go to ssa.gov/Medicare/Part D-extra help. I'll put a link in the description of this video. A question I often get is, what is a Part B drug? Not all drugs are billed through Medicare Part D. Some are billed under Part B as a medical service. These drugs are generally administered at a doctor's office. These are drugs like chemotherapy drugs, certain injectables, transplant medication, or insulin administered with an insulin pump. That's why sometimes you'll see a bill from your doctor's office and not the pharmacy. Another situation that comes up is what happens if the drug is not covered on your drug plan. If your drug is not covered under your Medicare Part D drug plan, Medicare will not pay for the drug. Medicaid will also not pay for the drug, and extra help will not help you pay for the drug. So here's what you can do. Start by asking your doctor if there's a covered alternative. Sometimes switching medications works. Next, you can request an exemption from your current drug plan. To do this, your doctor writes a note and your plan reviews it. You can switch to a different drug plan that covers the drug. When you have Medicare and Medicaid, you can change your drug plans more often than most people. Now, if you exhaust all these options, the next step would be to look into what's called a patient assistance program. A Medicare Patient Assistance Program is a financial help program, usually from a drug company, your state, or a nonprofit that lowers or covers the cost of your prescription drugs for people who cannot afford them. Some states offer Medicaid wraparound help, and as a last resort, you can look into discount drug cards. In my experience, if this is a drug you need and there are no alternatives that will work for you, it will usually get covered one way or another. Now, if you found this video helpful, go ahead and hit the like button. Don't forget to subscribe for more tips to come, and drop your questions in the comments below. I'll read them and I'll get back to you. Thanks again for tuning in, and I'll see you in the next one.